A wonderful day to you, ma'am and sir. This video presentation is for our outline research defense which entitled A Public Perception on the Implementation of Health Safety Protocols During COVID-19 Pandemic in Davao City. Before anything else, I would like to introduce myself. My name is John Brian Bangot, together with my co-researcher John Michael Cabigas and Angelo Steve Tubal. The purpose of the study is to obtain appropriate information about their public perception regarding on the health safety protocols applied by the local government unit in Davao City during pandemic, as well as to utilize a better understanding and to know what are the issues and problem facing by the citizens while having this protocol. The problem in its settings. As the coronavirus spread globally, several preventive measures are initiated by the government in order to control the spreading. The law enforcement officers have been anticipated to coordinate with all local shutdown, enforce stay-at-home mandates, and encourage social distancing, while completing the responsibilities for which they are already understaffed. Public health officials are scrambled in all affected areas to implement safety measures aimed to control the spreading. The Philippine administration enforced social distancing across multiple boards as protective measure which enlightens the community on safety lifestyle. The government formed an agency that mandates to regulate policies and actions in connection to the pandemic, which is called the Interagency Task Force on Emerging Infectious Disease. The local government unit of Davao City adopt an area-specific system for lockdown containing the movement of people where the clustering of infections are mostly recorded. Along with the local government unit, barangay have intensified the implementation of restriction especially in the movement of people which forced to stay indoor and repeatedly suit their participation. This study is limited to assessing public health protocols that is being implemented by the local government unit of Davao City during pandemic, whether it is under different quarantine protocols. The people's response to pandemic threatens their health and safety evokes a diverse array of emotional, cognitive, and behavioral response because of pandemic. Statement of the problem. The main intention of the study is to determine the public perception in the implementing health safety protocols during pandemic. Especially, it should to answer the following questions. The first question are, what is the demographic profile of the respondents in terms of age, gender, whether it is male or female, educational attainment, whether it is elementary, high school, college, or vocational. And last is the occupation. The next question, the second question are, what is the level of perception of public towards implementing health safety protocols during the COVID-19 pandemic in terms of A. Public healthcare system, B. Health policy, C. Medical facilities, and D. Security. The third question was, what are the issues and problems facing by the citizens during pandemic in Davao City? Hypothesis. The null hypothesis will be tested at 0.05 level of significance, which stated that there is no significant difference between public perception and the implementation of health safety protocol during pandemic in Davao City. Significance of the study. This study The result of this study will be useful, which provide information to the following. First, to the citizen. The findings of the study will give a detailed knowledge to the citizen of the importance of health protocols implemented during pandemic. Second, the government. The result of this study will help the government to address certain concerns exist during pandemic as their basis to develop programs that will assist the public to cope up with their problems. Third is criminology student. This study will help the criminology student to develop their knowledge and determine the suitable site to use as their data to the studies. And last, for the future researcher. This study will give insight which serve as a foundation for the related studies in the future. This analysis can also be used as a secondary source of data for a potential related studies. Definition of terms. Age refers to the years of existence of the respondent. Coronavirus disease is a type of virus caused by the novel coronavirus which lead to severe acute respiratory syndrome. Educational attainment refers to the respondent's highest level of education attained, whether elementary, high school, college, or vocational. Gender refers to the gender of the respondent, which either male or female. Health safety protocols is the standard system of rules used by the government as a precautionary measures to prevent the spread of virus and to control the movement of people in times of pandemic. Public perception refers to the believed thoughts and opinions of the respondent on the implementing health safety protocols applied during pandemic.
Today, I will be discussing the review of related literature. This presents the study that would help widen the context of the public perception in implementing health safety protocols. Public healthcare system. According to Folger, the Philippine government allocates a 3.2 billion budget to healthcare sectors for 2020. The fund will allow increase the quality of service, upgrade the medical infrastructure nationwide, address the issue of the medical personnel, and provide efficient service to the rural places during the pandemic. As the result, the domestic shortage reaches up to 290,000 according to the Philippine Overseas Employment Administration, which is considered risk of losing health professionals to serve in our country. In contrast, according to Cabrera, he argued that the Philippine healthcare system is still at stake in inadequate and malpractice of government-free medical consultation in public hospital doesn't work for sick people without any money, except for those who have lifetime maintenance medicine. Due to the loss of health professional, it is a greater risk for our country in fighting the surge of COVID-19. Next is the health policy. Health safety protocols are important and essential, especially these days, as people rely more in interaction for various daily activities. Daily, people go to work, shopping, transaction, etc., creating an scramble in the public places, often violates more protective measure implemented by the government in the interagency task force. Intervention needed to be more desirable to make public health protocols fascinated for citizens to follow, such as virtual reality activities, commercial, online conference, and many more. Safety protocols are required to prevent the lessen the spread of the contamination in the public places in the community, and it also educates people to follow the protective measures. In addition, rapid communication and publication due to its threat to the community due to the severity of the novel coronavirus, Filipino scientists and researchers aim to provide an initial basis to the policy decision. Their efforts made impact of the flattening the curve. Because of this curve flattening, COVID-19 response has made, particularly in the increase of testing capacity, enhanced contact tracing, large-scale treatment, and monitoring facilities. Awareness of the existing safety practices is an initial step towards improving healthcare service through the safe and quality care. Next is the medical facilities. According to Habonete and Concepcion, healthcare providers keep the culture in making the patient safe. Providing awareness through the needs of the patient will improve the quality of the service to utilize the performance of every public and private hospital in the country. In India's healthcare system, they face the major issues in fighting COVID-19 in rural places as they cannot provide the capacity of service community due to the lack of medical apparatus, financial because of the financial deficiency, efficient medicine, and lack of per capita. In addition, in Pakistan, they are one of the countries with the deficiency in acquiring the global requirement for the hospital and medical facilities. Next is the security. In France, drones equipped with speakers to enforce lockdown measures through the area. It reduced the efforts to the police officer in exerting efforts into the public places to minimize the risk for them from being contaminated in the social interaction. Furthermore, the Rwanda National Police urged to impose guidelines as it undergoes in lockdown. People who violates the minister's declaration will face prescribed sanction detention because there are some people who deceive the police officer for their ulterior motives. According to Kalinaw, local government units implement tougher sanctions to those who violate healthcare protocols and guidelines in response to COVID-19 pandemic. The measure addressed the risk factors of social, economic, and security grounds with the help of public order and safety personnel in barangays to enforce minimal health safety protocols in streets, alley, and public communities. Next is the issues and problem facing during the pandemic. According to the World Health Organization, the world experienced a drastic loss in public health, food system, and world of work. Due to the scarcity during the pandemic, people has issues in concerning on how they can survive during the pandemic without the full support of the government. In addition, domestic violence increases during the first week of pandemic due to the frustration of unemployed men. Lockdown are causes of not earning money to feed themselves and families, which result to aggression that leads into accidents of domestic violence, neglect, and sexual harassment. According to Human Rights Watch, there are some issues of people who violated curfews and public health regulation experience abuse of authority violating human rights from the police and local official overextend their lawful powers without respecting the international health care against cruelty, inhumane, degrading threats to people.
Good day everyone, my name is Angelo Steve Tubal. Theoretical and Conceptual Framework. This study associated with the two theories, namely Health Belief Model on 1950 and Theory of Reason, Action, and Planned Behavior on 1991, which would guide the researchers in determining the perception of the public on the implementation of safety during COVID-19. So according to US Public Health Service, Health Belief Model on 1950 understands certain reasons behind the poor participation of the people on tuberculosis screening to avoid such illness. This is applicable to the situation today where COVID-19 are continuously spreading and people eagerness apply implemented safety health protocols. Those individuals who understand the benefits of implemented safe healthy protocols during the pandemic will more likely to participate than those who did not. And it can give the frontliners a framework to better understand the perception of the public on the safety health measure and prevention activities being implemented. On the other hand, according to Fishbein 1967 and Eisen 1991, formulated a study called Theory of Reason Action and Planned Behavior addresses to some variables which can affect the participation and perception of the public campaign towards the health promotion and prevention. The next theory, the theory of reasons, actions, and planned behavior. According to Fishbein, this theory addresses to some variables which can affect the participations and perception of public campaign toward health promotions and prevention. So in relation to COVID-19 preventions and safety health protocols, Trap B can further interpret people's eagerness to obey suggestions. The purpose of obeying health protocols symbolize their attitudes with regards to their actions and perceived social support to follow recommendations. So also, this theory has a major component called the process of elicitations research. This would achieve by the doing group discussions to determine personal values, perception, behavioral intentions, characteristics, and perceived control over the desired behavior. After doing so, they will provide insight and tell appropriate activities and programs. The Trap B was the second most often theory used the following theoretical model of behavior change, according to Davis et al. 2015.
Chapter 2, Method. This section describes the research design, the research subject, the research instrument, data gathering procedure, and the statistical treatment of data. The research design. This study used the descriptive design. It was used to describe variables and examine the relationship among them. According to Agarwal 2008, as cited by Salaria 2012, descriptive method is a process of gathering data for a purpose of interpretation. This form of method are used to prevail proper analysis, comparison, trends, and a cause and effect relationship. Also, this research study uses a survey research in order to gather data by doing an interview to the citizens regarding on the implementation of health safety protocols applied in Davao City during the pandemic. Research subject. The collection of data were conducted from the selected barangays in Davao City such as the Barangay Los Amigos, Barangay Mintal, Barangay Talubo Proper, and Barangay Maa. The researcher interviewed 200 public individuals within the legal ages within the selected barangays in Davao City who served as the respondent and gave sufficient information and data needed in the study. Simple random sampling system was used to identify the population of the study. The research instrument. We use a survey questionnaire to gather appropriate data and information regarding the demographic profile of the respondent and the perception of the citizens regarding the implementation of health safety protocols in Davao City during the pandemic. The questionnaire was written in English that will translate into Visayan language during the actual survey in order to the respondent to comprehend the questionnaire. The survey questionnaire consists of two parts. The first part was to identify the demographic profile of the respondents. The second part was to know the level of perception that consists of public health system, health policy, medical facilities, and security. The second part used the scale to measure the perception. 5.50 to 5 describes very high, 3.50 to 4.49 high, 2.50 to 3.49 moderate, 1.50 to 2.49 low, 1.0 to 1.49 describes very low. Data gathering procedure. In conducting the study, the following process was observed. First is to conceptualize the problem and consult with the advisor. The first chapter is presented to the thesis advisory committee for some advice and correction for the benefits of the research paper. The second one is the survey questionnaire, which would use as an interview guide for the researcher toward the satisfaction of the research objective. The third one is it will be retrieved and data were tabulated. And last, when these were accomplished, the data will be analyzed and interpreted and it will be submitted to the advisor for a comment and suggestions. The statistical treatment of data. In order to attain the stated objective of the study, the data collected were thorough analyzed. The following method were used in the analysis and interpretation of data. The problem number one used a descriptive statistics such as frequency, count, percentage to answer the socioeconomic profile of the respondent. The problem number two used a descriptive statistics such as means, percentage, and multiple responses to measure the level of perception, includes public health system, health policy, medical facilities, and security. The last problem also uses descriptive statistics to know the percentage of the answer of the different issues and problems facing by the citizens during the pandemic in Davao City. And that's our outline research defense presentation. We hope that you understand our topic. Thank you for watching and thank you ma'am for the time you allotted.